Florence for Just Ask Podcast Live. Thank you, ladies and gentlemen, for tuning in. Now, you know what? As I always tell you, we have very, very interesting guests to come on and join us to give you some resources. And so this gentleman comes to see us quarterly. Now, let me say this. A lot of you sit back and say, you know what? I wish I knew some answers. I knew where to go, what resources are out there. Well, when we actually get a chance to speak to the attorneys, they give us a wealth of resources that you can utilize and figure out for yourselves if you need to contact an attorney or if it's something that you can resolve yourself or have a family member involved in. But this gentleman, Mr. Jim Schuster, has a wealth of information that we're all going to be needing real soon with this new budget cut. So without further ado, we want to introduce you or have our dear friend come back, Attorney Jim Schuster. Well, hello there, Jim Schuster.
Well, hello, Marcia. So good to be back with you again. Thank
Thank
you for
you.
the invitation.
You know what, Jim? First of all, I have to tell everybody that I didn't say elder attorney because I wanted you to know or let people know that have you retired or are you in the process of retiring?
Well, I have retired, though we do have referral, let's say, information sources available if anybody needs them. Just give us a call and you'll get the information or referral you might need.
Okay, all right, because that certified elder law attorney title down there below, people like want to call you and ask you some questions. But I'm glad you said we have a number, so we will put that number up for our viewers as well. So, Jim, we have a lot of things to talk about, but I want to go with the main topic today is that budget cut that's coming down the pipes, the Medicaid budget cut. So, I don't know how to start this, but with all this big beautiful bill stuff going on, I think that people are missing one main component that's going to affect not just our elderly population, but our disabled population, our disabled children or special needs and things of that neighborhood. So can we touch on that at all, Jim?
Oh, we sure can. We can talk about the whole field of elder law another day, but let's just focus on the current issues and people give them news they need to know. As you point out, Medicaid. If you turn on the TV, you'll hear some politicians saying they're going to cut Medicaid. People aren't working, so they can get these benefits. And let's just get one thing very clear right at the start. Medicaid is a health insurance program like Medicare. Nobody receives any money. If they quit work and don't work, well, they don't get any money out of Medicaid. And maybe if they're eligible, if they have to go to the hospital, Medicaid will cover it, but that's a separate issue. The point is, Medicaid is a health insurance program for people who are needy.
Correct. 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 So now most people don't know exactly what Medicaid covers. So is it something in particular that they should know, or some people don't even know they have it?
Well, the funny thing, that last point is exactly true. Now, this is where things in Michigan get just a little interesting. First of all, let's be clear that Medicaid does cover people who are children, people with disabilities, adults who are blind or disabled, and seniors over 65. So that's my little area right there, the seniors over 65. And so what it is, let's coming back to your point, trying to get to the idea of what's health insurance. Well, if a person in Michigan receives something like Healthy, Michigan, they know it's health insurance, but there's other programs they may not know are Medicaid programs
Hmm.
because they do so much more. And two of the most important for seniors, My Choice Waiver and PACE.
Okay. Okay.
Yeah,
Okay.
we can go into them if you see fit, of course.
Well, of course, because a lot of people utilize pay. So, and some people don't know
Yeah.
what my choice is. So, which one you want to touch on first? Because both of them are important.
Oh, Oh, well, let's just cover PACE because you already are familiar with it and you can fill in the listeners, anything I leave out. PACE stands for, oh my God, a
What is?
program for all inclusive
Okay.
care for the
Okay. I'm
elderly.
about to say
Sorry.
I see it somewhere. Okay. Okay.
Yeah,
Yep.
there it is. And PACE has organized kind of like its own little health insurance system. PACE will offer transportation, it'll offer doctor's visits, it'll offer hospitalization, it'll offer nursing aid. If you need help at home, PACE will offer that it's just like one big provider providing all these necessary services for seniors. And by the way, PACE and also waiver, I just want to touch on not just medical, but they can do home improvements. So,
Mm.
anyways, Marcia, back to you.
Of course. Of course. Of course. Well, you know what? So when we think about PACE or My Choice, we always think in terms of our elderly population needing assistance to move further on into a facility of some sort. So with this budget cut coming down the pipes, won't most of that be taken away and people won't notice it until like the last minute? I mean, Jim, let's be honest, people don't realize that these budget cuts are coming not this year in this year, but probably by the early part of next year.
Yeah.
That they should be prepared, getting prepared.
Yes. Now, I'll tell you that's perhaps the most important information we can give today. Let's just say the congressional politicians set this up so that, and by the way, they're going to have billions, they say they're going to save billions in dollars in Medicaid. And you know what that means for us. Anyways,
Mm,
when will these take place? After next year's elections. So that means that voters, who are seniors and disabled folks, you name it, will be getting their benefits and they'll hear about these cuts. They'll say, I haven't had any cuts. But when the election is over and the Republicans continue in control because they pulled that fast one on the voters,
mhm.
that's and beginning 2026, that's when they won't have their benefits anymore. So they got to really be aware and be alert.
Right. So, in other words, if you are using a home health care service now, you may not have that home health care service next year.
That's right.
Okay.
And maybe we might just expand on a little bit more what these programs do because believe it or not, the My Choice Waiver and PACE programs go beyond simple health insurance. They're wonderful.
Hmm.
For example, they can help a senior continue to live in his or her home, if you're ready for this, by paying for home modifications. Things like, bathroom changes,
Hmm.
kitchen changes, and ramps to the house. And by the way, if the house is in, let's say dangerous, unsanitary conditions, these programs will actually pay for the professionals to come up, whether carpenters, plumbers, you name it,
Hmm.
electricians, and repair the home, make it safe, sanitary, and livable. These are wonderful programs. Without them, where can people go? And if these programs close, they will be forced into nursing homes. A horrible fate.
Yeah.
I'm sorry.
Yeah.
I'm sorry.
No.
Apologies to all the people who work there, but I've seen too many people just languish and have nobody see them,
Hmm.
all day long.
But you know what, Jim?
It's,
This may now hopefully with our conversation today, this may help the next generation prepare to know that you just don't have to send your loved ones off to a facility because you don't know that come the first of the year or when next year that they're going to close the doors or they're going to say that the income level is too low, they can't stay here, and then you're scrambling around looking for, well, where I'm going to put my mom, where I'm going to put my dad. Well,
oh,
they had a home before they went to these facilities, so don't look at it
yeah.
like they didn't have something. If you have to
Oh,
do
yeah.
modifications at your home or if you have to do modifications at their home, then that's going to be the next best step. Because what happened to before these programs was developed, everybody took care of their parents at home. Now I
Yeah.
understand if you have a disabled person or a senior that requires additional care, such as some types of respiratory devices and things like that. Something beyond your ability. But if you are able to keep your loved ones at home and watch that money stay in the house because you're putting it back in to help care for your loved ones, that'll be way more easier and effective when this new so-called big bill, big beautiful bill go into effect.
Oh, that horrible thing will just ruin things. I mean, I can't even speak about that part. Let me talk about, let's say today, these programs, PACE and My Choice Waiver, they are so flexible. Okay, let's take a kind of a little unusual scenario. We want, mom to stay in her home.
Hmm.
a couple of them. Now, let's say daughter's been helping her out, daughters. You know how people don't get paid enough to pay for their own health care these
Mm-hmm.
days. Daughter needs to get a full-time job again, and these programs can do what family members would do. Watch mom 24 hours a day, even
Correct.
do bathing. They're wonderful. But let's change that a little bit more. Suppose that mom is living with daughter. These programs will still follow mom. And if daughter's house needs a ramp or bathroom additions, mom's programs will pay for it. These are incredible programs.
Mm-hmm.
Now, of course, before everybody gets in their car and rushes out the door, unfortunately, they're so popular, some of them have waiting lists. So we got to put out there at some time, of course.
Mm-hmm. Mm-hmm. So
Yes.
what do you think I mean, I want to say what should we do like right now, but should people be writing to their senators, their House of Representatives? Should they be saying something to get the ear of the people?
Well, I would simply say yes. Uh, wherever you meet with other seniors, whether it's church, at the activity center, senior center, coffee shop, spread the word. And Marcia, actually, I'm sorry, I just realized I'm speaking so fast that I'm probably going faster than your listeners can hear. So if we need to go back through something, you be the
Oh,
judge.
I'll
I'm
catch
sorry.
it. You know me, I'll catch it. So,
Okay, I
so,
do.
but
Okay.
there are a group of individuals that are connected with their councilmen and their House of Representatives, and they need to know that hey, if we have to have town hall meetings, to speak to representatives, let's do that. They need to know to have the church align with them to present to Congress or senators and say, hey, we're tax-paying citizens and we deserve to have our benefits. We deserve to have our package stay in place or increase, whatever it takes, but don't take it away and all of a sudden now you don't have plan B.
Yeah. Oh, yeah. And, I don't want to jump too far ahead, but I have to get this point out too.
Mm-hmm.
To my opinion, and I think it's a darn good one, these cuts make 0 sense. Now, a lot of people say, well, of course, you're in favor of benefits, but there's a gotcha with the benefits. So let's look at the little trick that the politicians put in Medicaid years ago. There's this thing called Medicaid payback, called a state recovery. So the way the program is currently already set up, unless people hire a lawyer, here's what happens. People receive Medicaid assistance. When they die, their estate, read family, has to sell the house, whatever they got to do to pay Medicaid back.
Mm-hmm.
So now the politicians know that. So why are they cutting Medicaid when they already have a way to try to get all the money back they put out? It is just, to my mind, is a clown show. That's all it is. Now, also, I do want to say what I just said. Politicians know that people know there are elder law attorneys who help people keep their homes.
Mm-hmm.
They aren't talking about that because they hope very few people know. They hope very few people listen to the Marsha Florence show and learn what they can do. But
True that.
I'll leave that subject to you, Marsha.
Okay. Well, no, you're fine because Jim, we did a segment before on the Medicaid Estate Recovery Act, and I remember
Yeah,
that, and you were giving us heads up back then to prepare for it, and to write to your councilmen and people of that
yeah,
nature, so that this bill, you got this bill on the table. I don't see, well, at this point where our new House of Representatives are in that this
yeah.
bill has been overlooked now, but is there a way that we could go back and, address that bill in some sort of way?
Well, okay, let's be clear. And now, just to if any listeners kind of sipping the tea and listening with one ear, we're talking about two bills. The current one is that budget one, but the older one we're talking about, where Medicaid gets your house, that came out 2 years ago now.
Mhm.
Here's the point. And now I'm sorry, folks, I got to get a little political, but the Democratic Party is most likely the party to elect to erase that bill, to retract it. Now, but just because we have a Democratic representative doesn't know that that's in their mind. So we still have to educate the people who are in office. And I'd even say go to city council meetings and let them pass the word up, because even though this is the state of Michigan legislature, the
Mm-hmm.
federal Congress, tell all the politicians about that. You don't like the idea of losing homes, and withdraw that law that you passed 2 years ago.
True. True. Yeah. Yeah. This is going to be an interesting year coming forward. It's a very interesting year. So, but at this point, so I mean, people are kind of laid back on it because they don't know what's coming down, and
Yeah.
it hasn't been finalized. But do we still really have a window, to address anything, to save anything? Do we
Well,
really have it?
the what we've been talking about is, let's say, a short-term incomplete answer. Let's get to let's say the lawyer's advice. The damage has been done. The Republican Congress passed this bill to cut Medicaid entirely, with the billions and billions out of it. I mean, the president signed it. It will be law. It will become law January 1st, 2026. Okay.
Mm.
I mean, we could change the Congress today, and if they didn't change the law, it'd still be in effect January 1st. We got to, however, spread the word. Marcia, I think
Mm.
you're more in the, let's say, the current realm of politics than I am. So, in community activity, let's just say.
Yeah,
So
thank you.
there it is.
Yeah. But you know what, Jim? So that means that we would have to endure these changes for 4 years. By the time this cabinet ends, hopefully, will we have an opportunity to revisit what we lost and get it back? Or they
We
probably won't.
will.
No?
We will. No,
Okay.
no, we will.
Oh, we will. Okay,
Yeah.
great. Okay.
And I
Okay.
will
But the
say,
suffering is for 4 years.
well, yes, but here's the but. The next Congress, okay, let's follow this. I mean, this is like high school, civics, if you want. The next Congress, if it were a Democratic Congress, we still have the President Trump. The next Congress could pass a law repealing that one. Now, of
Hmm.
course, we know Trump would veto it, but then if it goes back to Congress and they have this large majority to override the veto, and that's 60 people in Congress, by the way, Democrats are like at least 9 short in the Senate alone. But if that blue wave happened, let's just say, they could just veto the law, cancel it a little more than 2 years from now. But maybe and I'm just saying that's the
Hmm.
standard stuff, but maybe you would know, Marcia, in your contacts, whether there's enough open seats where the Democrats could take over or not. But I'm just saying to folks, it's very important to get out there and express your opinion and have it have be effective. There you
Makes
go.
sense. Yeah, it makes sense, Jim. I mean, I'm nervous in a sense because, as I do my job as a retired social worker, I'm always trying to look for resources for individuals and make it easier for families to, utilize the system so that they don't crash and burn. And
Yeah.
with the show itself, we also, want to highlight all these different things that are out here and so that people can feel supportive. Now, Jim, I don't know if you know it or not, but even will this will affect people's medical or hospital visits, doctor visits, will this bill also take effect where they will lose part of their benefits for seeing their physicians or the services that the physician
Well,
provides?
the short answer is yes. The prediction is that when the effect of this bill, doctors' offices will close, hospitals will close because they don't have enough patients to pay the bills. Now, remember, we're talking about, I'm a elder law attorney, but Medicaid services the whole population from birth to death. Now, working folks, a lot of working folks, are people who are of working age, they have a temporary disability, maybe lady has serious pregnancy issues that she can't work and she will be going back to work. A lot of working people need Medicaid as well. If they lose their Medicaid, let's just say, then they become Medicaid's and health insurance. If the Medicaid benefit isn't there, they get hurt, they get sick, they can't work, then what's going to happen? The whole thing is going to start collapsing, and there's going to people who need Medicaid, and if it isn't there, and
Mm-hmm.
if the doctors aren't paid,
Mm-hmm.
if the hospitals aren't paid, they close. You
Yeah.
see, so if you don't have Medicaid, you can't pay the doctor goes out of business.
I kind of want to say what was people thinking when they saw this, this plan for the Republicans to win the House. I mean, I don't think
Mhm.
people realize what was on the table here, or enough people. And then we have a lot of different entities saying they regret the decision they made for the Republicans to be in place. But now look at it. This
Yeah,
is a rough road right here, and it hasn't even started. Well, as they say, the party hasn't started yet now. So we're looking at what we're going to be facing in 2026 before 2026 get here. We need to
yeah,
know what to put in place or how to address some things in place, and not wait to the last minute, because you know what, Jim, to be honest, we've only got what 6 months or 5 months left in the year, and then all of a sudden, boom, all this stuff will start to take place. And I mean, the snowball effect of what's going to happen is just unbelievable.
yeah. It is. It is. And just pardon me for beating the little dead drum here, but it doesn't matter if your elected official is Democratic or Republican. They say one rule of a politician is they want to keep their job.
Mhm.
And if you're in Macomb County and the representative there, senator there, doesn't believe in what we're talking about, then voters start saying you're going to lose your job. He'll change his mind.
That is true. I've heard that quite a bit, And I had a question down here, but you probably already answered it. It says Medicaid already requires some recipients to pay back everything they received. Everything like what?
Exactly. Well, Medicaid, believe it or not, when Medicaid, what we call Medicaid state recovery comes around,
Hmm.
the bureaucrats there have like a great computer that spits out every page, and you'll even see things like where they pay for like a $5 package of gauze or something. Okay, everything, you name it, whatever they put out, whether it's somebody comes in and shovels your driveway, part of the waiver program, that's part of the pay score. Then that's part of the payback too. Okay, I mean,
Mm.
every little thing, not just the big hospital bills or tens of thousands of dollars, but everything.
So does that apply to the My Choice waiver and PACE program too?
Yes, yes. Any program now. What let's understand if we get the lawyer technical. This state recovery applies to benefits received after age 55. Okay, let's clarify that. I said I'm a senior attorney, elder law. So that's it. We're not talking about children now. Okay.
Mm.
We're
Okay.
not talking about mothers with babies. We're talking about seniors here. Okay. But for them, everything if it's, even if they stay at home, they don't have this waiver program, but they get prescription assistance. I just need help with my one prescription. Medicaid helps me. Medicaid says, after you pass away, your family's going to pay us back every dime. If it costs us $60,000 for those crazy expensive prescriptions, you got to pay us back. It is that bad. That's
Well,
it, Marcia.
they say it's going to be a hot summer now. This is going to be a hot mess. Okay, this is really going to be a hot mess. And ladies and gentlemen, I'm hoping that you're tuning in. If you missed this show, you'll get to see it on our other networks,
Yeah,
PBS and
yeah,
the website and everything. And it's important, Jim, that people get clarity on this early on, so they can do something. I don't know what, but do something. And most of it, I believe, is let's write to our House of Representatives. Let's write to our senators. Let's write to our congressmen. Let's have a voice behind us, or in front of us, that will speak for us, because we don't know the true effect until it actually hits. And when it hits, it's going to hit so hard and so fast that To me, it's a way of destruction. It's just total
Oh, it is.
destruction.
It is, and I would say, just adding on, like just what you're repeating, what you already said, the worst thing a politician fears is going to a senior meeting where everybody's angry and saying, "What's did you do?" Those
Hmm.
public meetings are a lot more powerful than individual letters. Okay, so invite those guys to your, your wherever we celebrate, your civic, you name it, senior group.
Right,
Yeah,
right, right. Do something. Don't just sit back and say, "Lord, help me." I mean, He's helping you, but you got to help yourself too, ladies and gentlemen. So
yeah.
we don't want to
Okay.
skip that notion. So, Jim, of course, I'm running out of time, but you know me, I always got to ask you when you come back.
Oh, I'd love to, Marcia. It's a pleasure speaking with you and to your viewers.
It's always a pleasure to have you. So hold that thought for me. All right. Well, ladies and
Yeah.
gentlemen, you know how I do things around here. So I want you to remember now, come October 2nd of this year, 2025, we will have our fifth annual Health and Fun Fair at the Samaritan Center Wellness Building. Now, notice we're not at the Eastern Market this year. It's okay. We're sharing the love on the East Side, and we want to make sure that our seniors and our disabled population get the chance to enjoy what we do here at Just Ask. So our seniors, our disabled population, caregivers, and the general public, come on out and join us. And if you want to be a part of this event, give us a call, 1-800-323-5336, 1-800-323-5336. Vendors, sponsors, donors, volunteers, and attendees all use the same phone number to ask for questions, ask us questions on what to do or to register at justasktalkshow.org. Fun fair. Had to get that out to you. So I'm your host, Marsha Florence for Just Ask, and what do I always say? Now, you know what? Please feel free to join us again when you want to see Mr. Schuster. If you got questions for him or anything, you see that number down below. Or if you need to call us, you know the number 1-800-323-5336, or email me at Marsha at Just Ask Talk Show. I'm your host, Marsha Florence, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. Oh, I said that really fast, didn't I? Don't be afraid to ask. Just ask. See you next time.